I think healthcare planning has one of the biggest misunderstandings in all of financial planning. The moment someone brings it up, people assume we're expecting something bad to happen, but that isn't the fact at all. In fact, healthy people are just in the best option to plan because planning isn't driven by fear. It's driven by options. One lesson I've learned over the years is this: the quality of our financial decisions usually decline substantially when we're forced to make decisions under pressure. So when you're healthy, when life is good, that's when you have choices. That's when the planning should happen. So I don't think the question is, what if I need long-term care? The better question is, how do I preserve as many options as possible for my future self and the people I love? And that's a very different conversation. It's elevating the conversation. When people hear long-term care, they often think about insurance. Sometimes insurance is the right answer. Sometimes it isn't. But thoughtful planning starts much earlier. We like to ask questions such as, if one of you needed care, what would you want your life to be like? Would you stay in your home? Would you relocate? Would one spouse become the caregiver? Would your children be involved? How would those choices affect your retirement income, your investments, your estate plan, and your overall family relationships? So because healthcare planning isn't really an insurance decision, it's a life decision. Healthcare is one of the retirement's largest unknown expenses, and Medicare doesn't cover everything. So long-term care can be costly. Health inflation continues to rise. And as we live longer than previous generations, planning becomes even more important. So the goal isn't simply paying for the care. It's about how to protect your independence, your dignity, your flexibility, and your spouse. So it's also about protecting your children from making rushed decisions during emotional moments. Sometimes that means insurance as a solution. Sometimes it means just setting aside investments. Sometimes it means building additional reserves or structuring your retirement plan differently. There isn't just one right answer because every family's priorities are different. What matters is having the conversations before a crisis. And I've often told clients, hope is not a healthcare strategy, neither is fear. Thoughtful preparation is. Because people who prepare for uncertainty don't spend their lives worrying about uncertainty. They worry less. Not because they know what's going to happen, but because they know they have a plan if life doesn't unfold as they expect. That's what good planning should do. Not eliminate the uncertainty, but reduce unnecessary anxiety. Because healthcare planning isn't really about preparing for illness. It's about protecting the freedom to make choices when they matter most. Thoughtful financial planning isn't about having all the answers up front. It's about asking better questions before making life's biggest decisions.